to be performing catheter care of a male with hand washing. This is skill number 8 in your headmaster booklet. The OSBN and headmaster are going to be managing your testing. So headmaster wants you to perform these skills in a certain way. Be sure you're familiar with this scenario, specifically the way that they have it laid out. So you need to perform all the steps in the checklist that are listed on the headmaster website. We are going to start now. So, knock, knock. Hey Terry, I'm Misty. We're going to be performing some catheter care today. So what I'm going to do is pull your privacy curtain over here and perform some hand hygiene before I touch anything in the room. I am going to go ahead and put on your bed break just because we're going to be manipulating your bed. And I've already gathered my supplies here. So what I'd like to do is bring in a basin for some water, some soap, a privacy blanket, and a couple of washcloths, and a little towel to hand dry. He's got a laundry basket right there within reach. At State, you more than likely will find it at the foot of the bed. I like to put my table here where I can reach it. Please note that in the headmaster skill checklist, it does not tell you when to get your water, so you are okay getting your water before you put on your gloves or after you put on your gloves. You just need to be sure you have gloves on before you touch your patient. So what I'm going to go ahead and do, since I already have everything here right by the sink, is go ahead and get some water. You're going to turn on the water. Make sure you check the temperature. You want to be sure it's nice and warm for your patient, but not too hot, because you are going to be cleaning his privates. So you're going to have about a third full of water maybe. And then I like to put a little towel under my basin to catch any little drips that may have fallen down onto the table. Then what I'm going to do is go ahead and perform hand hygiene again before I put on a pair of gloves. You should always hand hygiene before you put on gloves and after you remove gloves. Whether it's hand washing or hand sanitizer, you need to clean your hands. So I'm going to put on gloves. I'm going to go ahead and raise the bed to a comfortable working height. And then I'm going to go ahead and lower the head of the bed a little bit so Terry is comfortable as we're performing this procedure. All right, Terry, here's your call bell. So we're going to be pulling his blanket down just enough to the bottom of his gown so we don't expose him just yet. We're going to place a privacy blanket over him to make sure he's nice and comfortable. And then under the blanket, we're going to raise his gown just to the bottom of his abdomen under his belly button. We only need to expose what we need to look at to clean. Go ahead and lower his blanket the rest of the way so it doesn't get in the way. And while you're here, go ahead and check the tubing to make sure the tubing is not kinked or dislodged. You want to make sure the urine flows freely all the way down to the bag. And now we can get started. So we have our washcloths here. We have our basin of water and our soap. So I'd like to show you how I like to hold the washcloths. So I like to fold the washcloths in quarters, and then I fold it in a triangle. And I think of it as money. I like to keep the big part of the money in my hand for me, and then I like to give the little pieces away to other people. I like money. So that way you have lots of surface areas to clean. So what you're gonna do is fold your washcloth like that, get it nice and wet, and apply a little bit of soap to each of your layers if you want, or just to the middle. And then you're gonna make it nice and soapy. And you hold your washcloth in that same fashion. You want to use this portion of the washcloth because you don't want to contaminate all the little edges, so you don't want to wipe with this portion because you would be contaminating all the edges. So you're going to wipe right here with the center of the washcloth. You're going to tell your patient what you're doing every step of the way. Terry, we're going to be raising your blanket here so I can clean your privates. And at State, you're going to have a mannequin with a penis, and it will be kind of firm and pointing down, so don't be afraid to actually pick up and grasp the penis and pull it up so you can reach it. You're going to be very careful of that tubing. Reach under the tubing, and you're going to clean around the urethra, just around the urethra, the tip, and you're gonna go in a circular motion around the urethra, down the shaft of the penis. That's all you have to clean. You're gonna go in a circular motion around the tip of the penis towards the shaft. So you've already cleaned the tip. You can use that same washcloth, just flip your cloth over, grasp the tubing where it exits the urethra, and then clean down the tubing 3 to 4 inches. Flip your cloth over to a clean spot. You can go down the tubing 3 to 4 inches. This cloth is soiled. You can put it in your laundry basin, and now all you need is a clean cloth. So get your cloth nice and moist. Fold your cloth in the same manner. Have the big part in your hand, and you're gonna rinse it in the same way. Go under the tubing, around the tip of the penis, down towards the shaft. Flip your cloth over, you can rinse it one more time. Around the tip of the tubing, towards the shaft. Grasp the very tip of that penis where it exits the urethra, or the tubing where it exits the urethra, and then down the tubing, 3 to 4 inches. And then one more time, down the tubing, 3 to 4 inches. This is now soiled. You put it in the laundry, and now you have your towel. You wanna be sure you dry in one direction. So you're either gonna use the length of the towel and wrap around like this to pat dry gently, or you can use your towel and pat dry down the length of the tubing, flip it to a clean side, and pat dry down the length of the tubing. You don't wanna pat dry up. You're gonna cover your patient, make sure he does not stay exposed. Put that in the dirty laundry. You're gonna go ahead and pull the blanket back up so he's covered, and remove the soiled privacy blanket. Be sure your patient remains covered at all times. You can fix his gown, pull his gown back down underneath. Be sure he's covered and comfortable. Terry, we're gonna go ahead and lower your bed to a nice comfortable height, or a safe height. You're gonna raise the head of the bed. Place his call bell in reach. Okay, Terry, it looks like we're done here. If you need anything, I'll be back to check on you in about an hour, but you can always call us. I'm gonna put your bedside table right here. You're gonna take the supplies out of the room. This is gonna go in the trash. Just throw the paper towel away. You can rinse his basin, just empty the water that was in it. Rinse it out. And then you can dry it. Throw that towel away. His used supplies will go in his used supply area, wherever state tells you to put it. You're gonna remove your gloves the proper way, throw them away, and then you're gonna wash your hands. Any skill that says with hand washing requires that you actually physically go to the sink and wash your hands. Hand sanitizer is not sufficient. Turn on the water. You're gonna wet both of your hands. Apply soap. And you need to wash your hands thoroughly for at least 15 to 20 seconds. I believe it says 20 seconds in the skill. So you're gonna rub all surfaces, including your wrists. To get under your nails, what you can do is scrub your palms with your fingernails. If you don't have any fingernails, pretend like you do. And scrub your palms like this. That will suffice for cleaning under your fingernails. Be sure it's a full 20 seconds. And say your ABCs kind of slowly in your head. And then you can rinse. Rinse both hands, fingertips facing down. Don't flick your fingers. Don't touch the inside of the sink. Don't lean up against the sink. I just flicked my fingers. Don't flick your fingers. And then you're going to dry your hands with a clean paper towel. If you need more than one, dry them twice. And then you're going to get a brand new paper towel. You're going to turn off the faucet and don't crumple it. They consider that recontamination. And then you're done with your skill.